Moving along, I'd just like to introduce Robin Smith. So Robin's the inventors of Numnuts, and I'm not even going to try and explain to you what it does. I'm just going to hand over to Robin and let him do that.
Hello everyone, thank you very much for having me, and really special thank you to Mark and Pam and Robert from CentrePlus. They've really made me feel at home here. When you come from the other side of the world to Australia, it's the bit I enjoy most is nights like last night. Robert and Pam put me up in the house here, and it's just fantastic having conversations with Aussie farmers when you've been working on this kind of thing for quite a while. So thanks again to the Mortimer family. So Numnuts, yeah, it's a bit of a quest of my life. The story goes, this is where I come from. I come from a place called Helensburgh, just outside Loch Lomond. This picture I think was taken on the one sunny day last June. This is what the sheep look like, very woolly carpet wool animals, little black-faced things. Where I live, just on the west coast there, very rainy, very wet, unfortunately very different to what you guys have. And 3 months ago, me and my family got on the boat and we came over to Australia to launch Numnuts, which was the project that I've been working on for the last 8 years. Over in Scotland, the engineering's been done in Scotland, and all the science work and the vast majority of the funding has come from you guys in Australia. So Cyro up in Armidale has done most of the science. So this is the team that pulled it together, or certainly some of the team. Ali Small here, one of the world's, probably the world's expert, I would say, in animal welfare, animal behaviour studies. She's done most of the work on trisulfan, buckalgesic, metacam and Numnuts. So in terms of you guys here, have got one of the seminal experts. Ian Colditz, her sort of, I guess, professor that really knows the stuff. Jane Littlejohn got involved in 2014, the head of AWI these days, and Jim Rothwell, who's been a huge champion at MLA. So it really has been an international collaboration of the Modern Research Institute over in Edinburgh, who first brought the issue, I suppose, to my attention. I'm actually a design engineer. I'm not a vet. I'm not a scientist. And then once the weight and Australia put its strong shoulders to the wheel, we really started to get going in 2014. Our approach was slightly different to, I guess, that of a pharmaceutical company. What we did is, rather than taking a drugs approach, we said, right, we always try and take a user-centered approach. And for us, I guess the two things involved here, one was the animal, the lamb, and the other was the human that had to administer something to the lamb. So where we looked at is we looked at what the start point for us was, what was the pain behaviour that a rubber ring causes to a lamb. And I suppose even just to wind back from that a little bit, where we looked at, and this was back in 2010, when we looked at some of the welfare campaigns that were going on around mulesing and that sort of thing, and I guess the animal rights campaigns, we identified that essentially the smartphone was probably one of the biggest threats to the Aussie sheep industry. The fact that a backpacker can take a smartphone out to a farm or a shearing shed and that type of thing and just take pictures, pretty much, and then spread it across the internet wildly. So the reason that we chose the rubber ring as our start point is we believe it's certainly the most graphically acceptable method, shall we say. If you haven't grown up on farms and you are a city slicker, seeing lambs' tails chopped off with a gas knife or seeing mulesing is a challenge, I suppose, and when it's filmed on a smartphone out of context of the reason why you do these things, it's an issue for the industry. Rubber rings, although they're not painless, at least graphically, they're a lot more acceptable to the urbanized consumer. So we decided to use rubber rings as a start point, and rubber rings are good in that sense, but the issue with them is that they still cause a pain. The pain is like a throbbing pain. I suppose if we try and analogize it to being hitting your thumb with a hammer. The ring, when it's put on, is fine for a couple of minutes. If you put one on your own finger, you can probably survive for a couple of minutes without being an issue. But after about, I've never met anyone who can hold one on for more than 5 minutes, because as the blood supply is cut off to that appendage, you'll get a very intense throbbing pain in that. And that pain goes from about 5 minutes up to about 5 minutes to 35 minutes is where it's at its most intense. After 45 minutes, the nerve endings have been severed, the blood supply has been stopped down, and the pain goes down into more of a chronic pain phase, which is more like a backache or a kind of slow, manageable pain, discomfort, but manageable. So the issue we saw from the industry was there was not really nothing that coped with this part of the process. The way that vets looked at it was there's two different types of drugs available. There's local anesthetics and there are analgesics. So local anesthetics are, and I'll try and use the dentist analogy, when you go to the dentist, he will anesthetize one side of your gum. You'll still be able to feel that side, but he can stick a drill or a pin or whatever into that side and you won't feel it. Typically they take about a minute to take effect. They're extremely fast acting, and they're also relatively short-lived. So they might last an hour, and in a sheep we think they last about an hour. A lot of people say, well, how long does Numnuts last? I say about an hour. But the question, and they say, well, that's not very long, but the question is, well, how long does the pain actually last, or the acute pain? And it really is about an hour as well. So we chose a drug that we think best matches the pain profile. The other types of drugs, which you'll probably know about, Botulgesic and Metacam, they are both very effective analgesics, but they take a good sort of 15 minutes to half an hour to take effect, and they will last a bit longer. Typically, I think most vets would say up to 4 to 8 hours. So that's just a bit about the pain. The challenge for the industry from the human side was how do we get local anaesthetic into animals safely and effectively and keep up with the marking rates of an Aussie lamb marking grade. The way a vet would do it, and in the UK vets, it's illegal to castrate a bull without local anaesthetic. We also don't use rubber rings, but this was a trial that was done in Morden. A vet would nerve block using local anaesthetic. So how do we take this method and make it so that it fits in with the lamb marking production systems that you guys have over here, where you're lamb marking a typical contractor might be doing 1,000 to 1,500 a day. The design process to get there. So this is the design process that if you look at slides that many research institutes, they'll like to show you a nice we started with the concept, then we went to develop it, and then we did the production engineering. This is more what it feels like when you actually do it. And if any of you have invented or made things, and I know Australian farms are great inventors, this is the kind of way you go through a kind of very chaotic thing. So in the early days, this is back in 2014, we had a whole heap of different ideas. This was pre-MLA money, pre-AWI, just knocking around ideas, trying them on mock-ups and that type of thing. And just like genetics, it's a kind of evolutionary approach. You go out, you try something in the field, stuff works, stuff doesn't work, and you select based on certain traits, and you start to blend concepts together. So in this instance, this concept of putting the anaesthetic and the needle and the angle came out of this kind of noose idea that we had. But when we asked Aussie farmers, they were very nervous about moving away. We had an idea where you didn't have to have a tool, you just put like a lasso around it and you just tightened it up. But people said, is that really going to work to castrate my lamb? And there was a lot of nervousness. There's a lot of trust placed in elastrator rings, and by moving away from that, we felt that was probably a step too far. So we blended those two concepts together. And then it was just the simple case of I guess, 5 years of development work to get to this. And even within that, there's a huge amount of work. But as you can see, as you get further down the line, things start to happen. So just between that point and that point, there's 5 prototypes there, all of which we took out. We used the Scottish lambing season in April and May to do our trials out there, and then we brought them over here in July, August, September, up to November and things. So we were using both sides of the world. to develop and refine these prototypes. And this is a sort of evolution of just from prototype 1 through to 5. The one that exists today is now version 16. So without me talking a little bit more, I think it's probably best you seeing it in context. Hopefully the sound will work on this. Oh, sorry, one more slide. So Numnuts, what it is really a combined thing. We're not a pharmaceutical company, we're a device company that works with a particular type of pharmaceutical. So Numnuts itself is a device. It's something that puts a rubber ring on very efficiently and injects local anaesthetic at the same time. And Nummucaine, which is the drug, which comes with this unique cartridge collar part on the top, is the anaesthetic. And the two have to work pretty much hand in hand. And we've got a slide later that shows you how that is. But just to kind of give you and set the scene and in context, I'll let John, who's our Scottish design engineer, do that.
My name's John Ritchie. I'm a design engineer with 4C Design in Scotland. We were first asked to look at the solution to pain animals experience during the necessary husbandry procedures of tail docking and castration. First we asked vets, and they told us their pain relief drug of choice for pets is to use an injectable local anaesthetic. But they said the issue was delivering it safely and targeted to the right place in a farm environment. And farmers told us it needed to be quick, easy and reasonably priced. They were insistent that it didn't slow down the marking process. We spent years designing, testing and refining a system that's fast, safe and simple to use. And here it is, the patented Numnuts device. There are three aspects to the tool. First, we've got the applicator. It uses the same elastrator rings as standard pliers, so from that point of view it's a familiar process. But we've considered the ergonomics of the tool to make it more user-friendly as well as fit female hands. And crucially, it incorporates the needle and injector, allowing you to administer the anaesthetic consistently at the right spot and at the same time as applying the ring. We've worked hard to make a custom injector that works in 2 stages using a single button. With the band in place acting as a guide for the injector, the first stage moves the needle forwards out of its safe position and into the animal. Then as you continue to push the button, you deliver the dose. With one hand on the applicator and the other on the injector, both hands are always away from the needle. The third part of the system is a quick change cartridge. It's got 100 ml of Nummucaine local anaesthetic, which is good for about 65 doses. When the bottle's finished, it's just a case of twisting one off, putting a new one on, and you're ready to go again. It's fast, it's simple, it takes the hassle out of broaching bottles, and you and the lambs don't have draw-off tubes to get tangled up in. And as an extra level of safety, the design of the cartridge also restricts access to the drug when it's not in use. We've been developing and testing the prototypes out here in the farm environment, and we've helped relieve the pain that would otherwise have been felt by thousands of lambs during our trials. The farmers and contractors we've worked with have picked up the process of using the new tool very quickly. It's not slowed down the marking of the lambs, and we're really getting positive feedback from them. Happy lambs, happy farmers.
John's originally from Brecon, so I hope you can understand that. I'm from Scotland too, and I know what you're going to be wondering, how much does it cost? So the device itself is $385, including GST. It comes with a kit. I've got some here, you can have a look. You can buy one if you want. It comes with a kit with water, so you can try it before you try it with the drug on a banana or a zucchini, needles, and a spare fluid junction. The drug, the Nummucaine, it's 67 cents a dose. Has no withholding periods, but obviously a lot of effort's been put into getting the drug APVMA approved, and some of its good properties. You don't need to keep it in a fridge. It lasts for 2 years, so if you have some extra, you can keep it it's 65 shots. There's a 1.5 ml shot in each bottle. So assuming you're using it on both the tails and the nuts, you'll get about 45 animals out of a single bottle. That was why we designed that quick change cartridge, because a good, well set up lamb marking contractor will be changing a bottle every 15 minutes. We wanted something that you didn't have to fiddle around with tubes and slow down the process. So you can broach 3 or 4 bottles and just connect them in, and it takes 5 seconds to do that. Getting a product like this to market is really tough, particularly in another country where you don't know anyone. So at the moment, it's available online. So we've got a website, and we're using Australia Post. I've shipped out 250 parcels to farms in the last 8 weeks, and they've not lost one of them. So you come along, you buy it on the line, and I post it out to you. And typically, an express post, it's getting to people within 2 or 3 days. If you need to know how much it will cost in your property, we've got, if you go to register your interest, we've got a cost calculator with sliders, so you can tell us how many sets of balls you're going to take off, how many tails you're going to use, and it will calculate the cost, how many bottles you need, how many devices you need. In essence, if you're using it on both, it will average out as $1 a lamb. So it's, yeah, if you've got 1,000 lambs, it's $1,000. Rather than me just talking all the time, I thought it'd be worth at this point just showing you reflecting on some of the people that have been using it over the last 8 to 10 weeks. To say it was only launched about 10 weeks ago at Merino Link up in Armadale. Here's Audrey Bird, who's actually over in WA, and telling you.
Yep, I'm Audrey Bird from Wickerpin, and we trade as Windora Farms. So we're about 250 kilometres southeast of Perth in Western Australia. We've got two flocks. We've got a Merino self-replacing flock, and we also got some first cross ewes, Border Leicester Merino cross ewes that we breed prime lambs with. It just makes good sense. It's all part of you know, being aware and looking out for things that can help run our business better, help profitability, and also the animal welfare side of things. I mean, you know, I am a great animal lover, and anything I can do to ease the pain. I mean, both good for the lamb and good for us farmers. So I think it's a win-win really. Thanks to Robin Smith from Numnuts. He has agreed after some pestering from me, because I've been watching this product for a couple of years now. I've been really keen to try it on our flock and just see how this new applicator and this new system, the pain relief system, would work in the cold face, I suppose you'd call it, out in the yards on the cradle. And yeah, I've been there's been 3 of us that are working on the cradle. I've all had a go, and we've been very impressed with the design of the applicator. We're finding it actually easier to get the rings on than the normal Illustrator applicator, and applying the pain relief is it's very easy, and it hasn't slowed us down at all. So yeah, all in all, I'm very, very excited about the fact that this will be released soon and be available to every sheep farmer to use. I think it's great product, and it's great to see things like this coming along. And they were still showing some signs of pain, but after they had been out of the cradle for a minute or two, you could see that when they were going back to their mums, they weren't squirming around like what they normally do. They were still showing some discomfort, but definitely not to the extent that they were showing it before.
Right. So just to show you from the technical side how it actually works, that's a sort of simplified diagram of a sheep's nuts. And what we're doing is we're actually using the ring and the device work in combination together. So when the device puts the rubber ring on, and we use the ring as a clamp to hold and centralize everything into a central location. And what local anaesthetic does is it nerve blocks the transmission of pain up to the animal's brain. So the needle, you can do it with this laser pointer, comes in from this angle here. Oops. Comes in from this angle here, and it deposits the anaesthetic in a pool here. And what we're trying to do, what that does is it nerve blocks that transmission, that throbbing pain around the brain. If you were just to sort of freehand put anaesthetic in, there's a good chance you might hit this part there. There's a lot of cod fat there that will just absorb the anaesthetic. And if you didn't do it in combination with the ring, you could end up essentially missing the nerves altogether. So that's why we had to design a device that was half mechanical, half pharmaceutical. with the tail, and the tails are important too. Correct best practice tail length is 3 palpable joints that back from the base of the tail. Certainly, what I've seen a lot is a lot of short tailing happening in Australia, which is, can cause other problems elsewhere. So, and it puts the anaesthetic in at this point between the joints. So it does involve a little bit more. The first, 50 or 100 you do, it involves a little bit more thought, particularly in the tail, because you've got bones in there to inject around. But once you've got your eye in and feel, generally after 100 or 2 lambs, people are just up with the normal pace that they're doing. So to say, it's only been available for about 10 weeks. How's it going? This is how many we've sold. There's about 170 people out there using it, and yeah, about 95,000 lambs have had it. So really pleased with the uptake in Australia. And I think this part here, there's a big story around this, and one of the reasons that AWI and MLA got behind us was they wanted to have a front foot story on a welfare issue for Australia. And I think you guys in this room can really help hold your head up proud and say, this is an Australia first. You guys got this first. It's not going to be available in New Zealand until next year. It's not going to be available in the UK till next year, and it's probably not going to be available in the rest of the world for many years to come. So this, in combination with the 3 other products that are available, are not available anywhere else in the world. So I know the industry's taken a hammering in here for many years over mulesing, but there's a real opportunity here to change the dialogue and change the rhetoric about Australian wool. The fact that you guys are using, and you're actually well ahead of the Kiwis and the UK on using pain relief. So I can say that as somebody who comes from the other side of the world. So yeah, to date, what people have been saying about it, what I like about it is that there's a lot of talk, and maybe our name helps a little bit. Can they use this on politicians? But when we put this out there, there's a lot of, I think, awareness and interest within this space, and having positive stories in this space. There's a few people who've been out there trialling it, and really what's great is this chap Andrew Edgar. He's a prime lamb producer down in Victoria. What he did was a series of trials where he took, just homemade, but he took mobs of about 380, and he did a mob where he just did some on the nuts, and then he looked at how it went. He did a mob where he did it on both, and it went a bit better. And then he did a mob of 380 where he just did the ring only, like he used to did. And it's when people go back to doing it with the original pliers that they really see the difference. What he said in his tweets here is he's measured the time to take the lambs back out to paddock, and the amount of dog power and the amount of effort. And no one wants to see lambs lying around in pain after lamb marking. So that's where the producers are generally coming back to us saying they're seeing the big benefits. It's 4 o'clock, it's winter, it's dark, whatever. They're getting them back out to the paddock smoothly and easily. Some lamb marking contractors have given it a shot as well. So Lisa Vagona's quite a character down in Victoria as well, and she lamb marks about 180,000 lambs a year. So she's now on board and using it with a lot of her clients. Some people are using it in combination with botulgesic, and like Ralph before, that works really well. So you can use a local anaesthetic for the first sort of hour of pain, and then the analgesia kicks in. So that's an excellent way of doing it, combining it. So either with Metacam or botulgesic. And a vet over in WA as well, Adrian Baker. These are 3 comments that he got back from clients. So generally, really pleased with that, and it was, took a big punt on coming over and launching it this year. But overall, delighted when I asked most producers, have they seen the difference? They all are. So they can hold their heads up high and say, yeah, we're doing the very best for the lambs that we want. So yeah, back to my squiggle, my creative thought. I mean, it doesn't stop here. This is version 16. Version 16B is already in the pipeline. The feedback that those first 100 producers have given me, they've identified fairly quickly which are the weak points in the design. The engineers in Scotland have already upgraded a couple of the parts, so the next wave that comes in are going to be better. Yeah, I really respect the fact that there's early pioneers that have given it a shot, given us this feedback. But by and large, I say I've sold 180. I think I've had about 10 people that have either had a breakage. Most of them, it's generally a lamb kicking or something like that. I know when you work with animals, that's what happens. But by and large, they're all getting on pretty well with it, so that's been good. I've got a little demo lamb here, so you can all come have a go and have a play around with it. And thanks again. That's Numnuts.
Robin. I know Robin said he was actually looking for volunteers to know how good the pain relief is. So if you're feeling keen,
the humans actually.
Anyone got any questions for Robin?
Those modifications you're making, will they be able to be retrofitted to these?
Oh, absolutely, yeah. So, I mean, I'll just be totally upfront. Like the device itself is, say, the bottle all comes with this on it. So you plunge it down. It's quite modular. So we've designed the ring applicator. So step one was to make a better ring applicator. The extra step that we're asking people to do is a plunge. It's that action there, which takes about 0.3 of a second. But everyone moans that's still an extra step. So we wanted to make the actual ring applicator better to combat that. So the two advantages of the ring applicator is it now has an over-centering action on it. So it still takes an effort to get the ring open, but once it's open, you should find it's less strain on your hand. So if you're doing 1,000 a day, you'll know that your hand will feel it the following morning. What we're hoping to do is try and reduce the repetitive strain on people's hands with that. We've also changed the action, so I guess your strongest grip is your tennis racket grip. So we're working with that rather than with the old tools. You squeeze up and you have to twist your wrist if you look closely, and that's what creates the strain on the wrist. So the point I want to say is that the ring applicator we've tested and we've designed to last 100,000 rings with test rigs. We've dropped it in the dirt and put it back in the test rig and that kind of thing. The bits on the top side are more like a multi-dose injector, and they're kind of semi-replaceables, if you like. So this part here is probably the most, I guess, vulnerable part to damage. It's a $15 replacement. And that's the part that people are breaking, I guess, at the moment. So we're putting 2 into every box now, and some of the design changes we're making are just thickening up some of the plastic around that to increase its strength. But as I say, most people are getting on fine. It's difficult for me because I only ever hear back from the bad ones. So the drug, as I say, it all comes with this on top. So you simply put it down on the oil drum, and you push down to plunge, and then you connect it in, and then single pump, and that primes it, and then you're off and running. Changing the needles, so you just twist off, put a new needle on, and back on again. So it's been designed to be reasonably modular with, and the main improvements that we're making is actually just around that part, with a few tweaks on this part as well, just to improve reliability.
How's it going hitting the bone in the tail?
Say again, sorry?
How's it going hitting the bone in the tail?
Yeah, so when you get to the tail, the needles are pretty sharp and they will actually inject into the bone. But what we want to try and do is find that space in between. And it's kind of a feel thing. It's really hard to explain, but if we've designed this part is a dual stage injector, so it won't actually inject the dose unless the needle is fully inside the animal and it's gone through its full 12 millimeters travel. So it's only once it gets to the point there, then the plunger will plunge. So what will happen is if you get it into a bone, it should lock up, and you just give it a little squeeze on the handle, readjust, and you can adjust the angle as well, the angle of attack, and often that'll fine. If you're using it on a particularly skinny lamb, obviously the joining times are different, so you have some lambs that are 5 kilos and some that are 15. If it's a particularly skinny tail, what I suggest is you might not need even the full dose, you can just squeeze it halfway. And the thing about the local anaesthetic is even getting a small amount in the right spot makes a massive difference. It's not like a sort of vaccine or something where it's very weight dependent. It's, you know, if you miss it, you can give it a second shot in the nuts, or if it's a particularly skinny tail, you've got a problem there. What I would recommend is do not force it hard into the tail. Again, we've used it across 15,000 lambs in our trials, and there's over 100,000 there. But you only learn about rare outcomes when you start doing big numbers. And I think that whole thing, we've had one farm I think the guy was pushing it really quite hard into the tail, and some of the lambs were getting an epidural. So they ended up with wobbly back legs. There's sort of two sides to that. I mean, one, we know for sure they weren't feeling anything. But it obviously, it's not ideal, particularly if you're wanting to drive the lambs back. But that was off out of a mob of I had a customer the other day, a mob of 1,800. He had one that he needed to put on the quad bike and take back. It's totally temporary. It wears off after half an hour. So yeah, some of the feedback that's coming from the field.
We used it at
Yeah.
the sire evaluation site, so I was just talking wrong before, and yes, it took 100 lambs, I reckon, for Matt to get used to the tail.
Yeah.
But it didn't slow the lamb market process down, and definitely they weren't squirming as much, so yeah.
Yeah. Good. Thank you.
Robert, has there been any work combining the anaesthetic with the analgesic in one treatment?
Yeah, that's what everyone has, the holy grail. It's the issue is you need deep pockets and time to be able to do that. The APVMA are obviously pretty good at stopping, not stopping progress, but making sure that all the boxes are ticked. So what we'd love to do is develop a combined long-acting, slow-acting in one bottle. I say my challenge is I'm an engineer, I'm not a pharmaceutical company. So I was at Don McDonald Wool Brokers event, and what I'd love to do is partner up with Bayer or Troy or one of the pharmaceutical companies to actually do that, and we can't do that off our own back. What we want to do is invent clever new gizmos to make your lives easier to get stuff into animals more effectively.
Just is the work being done on the pain? We know that we all see the result of the nuts. But on the tail, is it? I mean, what sort of pain?
Yeah, the tail is actually probably the one where there's been the most amount of debate. So I think a lot of people. I get amazing cross sections. Some people think the tail's worse than nuts. Some people think nuts are worse. Yeah. Some people think they're both bad. I think the way I always try and analogize it to the human idea. So quite a few customers have bought it and just use it on the balls and not used it on the tail. And they're like, no, it's kind of working, but they're still... I said, well, did you use it on both? They said, no. And the way I try and analogize it, if I put a ring on your finger and then anaesthetize that, and then I put one on your toe, your little toe, you would complain about your toe. So animals will show you where, what they're feeling. And it's not that one or the other is worse or better. It's just it's different. I think is the best that I know. And Ali Small, the way they measure the pain is different as well. So a gas knife, a lot of people like gas knife because it gets it over and done with. It's done. The tails are off straight away. And they also think, a lot of people think the gas knife isn't as painful. And I don't know the answer to that, but what I do know is the type of pain from a gas knife is different, and again, humanizing it, the type of pain from hitting your thumb with a hammer is different to a cut with a knife, and the way that a human responds is different. So the hammer is generally a thrashing pain, so the ischemic pain is what you'll see is the lambs wriggling and writhing and get this thing off. Whereas a cut, people generally stand still and they're frightened and they pull in, and if you break an arm as well, they don't. So I think the understanding about pain a few years ago was, they're not writhing around as much, they're not in as much pain. It's just, but actually the way that the pain manifests itself is different. So all I do know is that using local anaesthetic helps. So